Thanks for joining us again on the Daughters of the Moon podcast. Mom and I are both super excited to have you here with us today. And we have Dr. Kate Hadfield back with us today. She was actually a previous guest on episode 90, where we talked about changing the status quo in women's health, which was a really good one. So if you didn't listen to it, it's a great one to go back and check out. So welcome, Dr. Kate. We're really excited to have you back on the podcast with us.
Well, thanks so much for inviting me back. It was good last time. Lots of fun.
It was. It certainly was.
It definitely was. So we're going to talk about perimenopause today. So do you want to lead us off and explain to people the difference between perimenopause and menopause, and we'll get
Yeah.
the ball rolling
All
that way.
that good stuff. All that
All the
good
good
stuff.
stuff. Yeah. So I feel like perimenopause is really having a moment right now. It really wasn't talked about before, and now it seems to be everywhere on social media. There's books coming out about it. It's a big thing. And so one thing I always start with in my practice is making sure that we're all using the same terms and that we all understand what we're talking about, because there's a lot of confusion, even in the medical profession. So the first thing to consider is, what is perimenopause and what's the difference between perimenopause and menopause? So menopause is really easy to define because it's defined as 12 months in a row of no period whatsoever. So it's a very clear endpoint, right? And I do have some patients who get to month 11 and then get a period and they have to go back to the starting line, which is very frustrating for them when that happens, but it can happen. So menopause is an endpoint. Perimenopause is that time before menopause where hormones are fluctuating. And it could be anywhere from like 2 to 10 years, which no one wants to hear, but unfortunately that is true, right? And it's very much hormones fluctuating. It's like a roller coaster ride. So we like to think of that journey towards menopause as a nice slow decline of estrogen and progesterone, nice and slow in a linear fashion until it hits zero and now you're in menopause. And unfortunately, that's not the case. That isn't what happens. Now, progesterone does a bit of that linear decline towards menopause, but estrogen does not. Estrogen goes on a roller coaster ride. So it could be very high some months, it could be very low. It's all over the place. And progesterone really acts like an anchor to estrogen. So as progesterone slowly going down and estrogen is going up and down, you will feel the effects of very high or low estrogen more because you have less progesterone to balance it out as well too. So that's a really important distinction. A lot of women will think that perimenopause starts after 40, and that certainly could be true. But I think you can also start seeing some of those symptoms as early as 35. As well. I've certainly seen that in my patients. And some of those symptoms might even be confused as PMS. So we start to see a lot of more PMS symptoms. So irritability, breast tenderness, bloating right before the period. Sometimes periods will start to get heavier during perimenopause, again, because it's more of that high estrogen type picture that we're seeing. And during perimenopause, periods can actually get closer together. So we like to think that, like, oh, you're getting closer to menopause, the periods will space out. And that's true when you get very close to menopause. But in the perimenopausal times, we actually see them cluster. So you could be having like 2 periods a month, right? And so that's something that's really common to see as well. So I think it's always important to kind of start with that definition of like, what's the difference between these two things? Because I find that sometimes patients come in and they're using the two terms the same, or they're trying to have this conversation with their care provider and they're using these different terms. And it's just good to make sure we're all speaking the same language.
Absolutely. Yes. And it is confusing, right? Because
Yeah.
there's all kinds of information out there. So I'm glad that you cleared that up because, we like to know what we're dealing with.
Yes, absolutely.
Yes. So what
Yeah, I started very young.
sort of
Okay, I started very young in my 35. I think it was 35, 36, and I finally passed 52. So it was a long
Yeah.
time to be, yeah, it really was. I
Yeah.
thought I should say that because you said it. I thought, good, you did that.
Yeah, it can go on for a long time as well,
Yeah.
right? Yeah, it really depends.
So what are, like, you talked a little bit about the symptoms. So is there anything that we can do for these symptoms, or what we should start looking at when these are coming at us, the different, the bloating and those kind of things? Is there things that we can do for that?
Yeah, absolutely. Right. So, I'm a very big advocate of doing good blood work to really understand what we're dealing with here, right? So, what your labs tell you will really help your practitioner focus on what the biggest areas of treatment should be for the most part, right? So, like, you need to know if you have low iron, because iron can make a huge impact on like sleep quality. Even things like hot flashes can be massively impacted by low iron. And if you're bleeding a lot more heavily or more frequently, your iron is most likely going to get impacted, right? So there's good blood work that should be done to check on these things, right? You should check your thyroid levels, because thyroid is going to play a really big role here. And you should absolutely check on blood sugar levels as well too. So insulin resistance is a huge thing when it comes to perimenopause and as women get older. And the more insulin resistant you are, so the less you have good blood sugar and insulin balance, the worse all the perimenopausal symptoms are going to be. So I would always start with like really good, solid, in-depth blood work. Except, oddly enough, when it comes to hormones. So it doesn't actually make a lot of sense to test sex hormones during perimenopause, because like we talked about, by definition, they're changing all the time, right? So a lot of women will come in and they'll say, I think I'm in perimenopause, I want to check my hormones, right? And it's like, I wish we could do a lab test that would just tell us if you're in perimenopause or not, but it just doesn't exist, right? So and we could run your sex hormones, but if we run them and it says your estrogen's high, it's like, okay, your estrogen was high that month, what's it going to be next month? Like, we don't know. All the blood work is a snapshot in time. And so if perimenopause is by definition a time of fluctuating hormones, then getting that snapshot really doesn't impact our treatment very much. So that's something to really understand. I really like doing blood work. I think it's very important. The perimenopause is one of the few times where the symptoms are actually more important than what the labs tell us as it relates to sex hormones. The other things like a cholesterol panel, liver enzymes, iron, yes, please get all of that checked out. But it doesn't make a lot of sense to check sex hormones. So that's just a really good piece of information to understand. And some people will say that their practitioner is ordering blood work to check if they're in menopause, right? That's like, well, when was the last time you had a period? Because if you haven't hit 12 months in a row, you're not in like you're not in menopause, right? So we don't need a lab to tell us if you're in menopause or not, right? So that's one thing. And so depending on what the blood work says, then it really focuses you on what areas could need help, right? Do you need to sort out your iron? Do you have low B12 or D? Like, what's your thyroid up to? So those are all things that need to be checked, right? So I would say one of the biggest things that women can do to help buffer those hormonal fluctuations is pay attention to what's happening from a blood sugar and insulin perspective. That probably has the most impact on what's going on in perimenopause.
Hmm. So could then that, like, if your blood sugar is a little bit out of whack then and you're in perimenopause, can that, like, would that then start affecting like your hot flashes and then your brain fog and some of
Yeah.
those things that your sleep disturbances, things like that?
Yeah, 100%, right? So it's important to understand just how vital insulin is to the overall functioning of your system, right? So insulin's job is to move sugar from the blood into the tissues to create energy. Like, that's its job, right? Insulin also controls the enzymes that are involved in hormone breakdown. So if you look at one of those very scary biochemical sheets that looks at, estrogen gets turned into this and cortisol and testosterone, all those types of things, the enzymes that are involved in breaking down those like metabolites of the hormones are directly impacted by insulin. So if you are trying to, quote, balance your hormones, but your insulin is out of whack and essentially too high, you're not going to get anywhere, because you have to go after the insulin to then have an impact on your hormone balance.
Well,
That makes sense. So,
Mhm.
how do people deal with high insulin then? Like when it's out of whack, is there something naturally we can do, or is that something that there's pills that we would have to go on, or how do we deal with
Yeah. Yeah, so combination of many things, right? And it depends on how significant the insulin resistance is, right? So when I talk about insulin resistance, it's kind of like a pre-diabetic state. So I find that conventional medicine tends to look at blood sugar balance from an all or nothing perspective. You're either healthy or you have type 2 diabetes. And so generally speaking, you don't just wake up with type 2 diabetes one day. There's a slow progression towards that state. And oftentimes the research suggests that there are 4 or 5 stages that you go through before being diagnosed with type 2 diabetes. So if we think about it more as a spectrum, as someone who's like totally healthy over here and someone with type 2 diabetes over here, then this spectrum is insulin resistance. So you are producing insulin, but you're resistant to hearing that message. You can't quite hear that hormonal message, and you could be anywhere along that spectrum, right? So you can assess that through good blood work for one thing, and that kind of lets you know how significant it is. And then you kind of get to the treatment aspect of it. So the first thing always to consider is diet and lifestyle, right? So how active are you during the day? You know, are you exercising? Or even more basically, like how many steps are you getting? What is your movement pattern like during the day? That has a huge impact on things. And then from a dietary perspective, you know, I would say the most important thing is how much protein you're getting, right? So most women are vastly under eating protein, like unbelievably low. So we really should be aiming for about a gram of protein per pound of body weight, unless you have a significant amount of body fat to lose. And I would say at first visit, most women are getting on average like 50 to 60 grams of protein, and it really should be more around like 120 or so, depending on their body composition. So you women are amazingly undernourished with protein, and that has a really big role to play in terms of balancing out blood sugar and insulin, right? So diet and lifestyle is key, and then we can get into, you know, what that supplement plan might look like, right? So part of it is helping to blunt the effect of blood sugar and insulin. Part of it is trying to change the gut microbiome, so the different types of bacteria make up in the gut, because those can be associated with insulin resistance and others are not, and certainly decreasing inflammation overall in the body, because that really compounds the insulin resistance itself.
Hmm. So,
So that also,
no, go ahead.
so can I also bring up glycemia? Can that
Sorry, say that
also
again.
be hypoglycemia?
Hypoglycemia?
Yeah. Can that also
Yeah,
affect when you're doing range?
yeah, totally. So hypoglycemia, or like low blood sugar episodes. So I think that's also a really important thing to look into why that's happening, right? So sometimes we see low blood sugar episodes happen if someone's like really burned out. So if they've been stressed for a really long time and then they've just kind of tapped out, then we need to address that, because that's also going to create a dysregulated pattern, right? Because if you're eating and then things are spiking and crashing all the time, that's also not good for your overall blood sugar stability. It's just, and it's eventually going to lead to insulin resistance. It's just different than having high blood sugar and high insulin all the time, right? So we want consistent, like a consistent pattern of blood sugar and insulin release, as opposed to either too high or spiking and crashing.
Okay.
Mm-hmm.
That makes sense. So, for steps, you were talking about steps and being active and those kind of things. So, what on average would you say for a normal person is a good step count to have in a day?
Yeah. So I think the stats are right now that on average, most North Americans get about 3,000 steps a day, which is really low. It's really, really low. So people are waking up, driving to work, sitting all day, and then driving home, and that's kind of it. A lot of people think that aiming for 10,000 is what we should all be doing. And if you want to, by all means, aim for 10. But what the research shows is that you get the max benefit around 8,500. So even if people are just aiming for around 8,500 steps a day, That's fantastic. And your phone will naturally just count those steps for you. You can buy a Fitbit. I have an Aura ring, which I really love, that counts my steps. And it's not too difficult to reach those 85. And people underestimate how impactful that can actually be. So there's been studies that have been done that compare people who are sedentary all the time, and then go to the gym like 3 times a week and have like prescribed exercise time. And then they compare people who don't go to the gym but move more during the day. So they're hitting those steps. And the people who are not going to the gym but are more active during the day and hitting their steps actually do much better in terms of outcomes and their overall health than the people who are sedentary and then just go to the gym. So we have a very fixed idea about, like, if you're not going to the gym 2 hours every day, like a CrossFit, and suffering, then it doesn't count as exercise. And it's just not true. It's just not true. Movement is really key. You get the most benefit from that.
That's amazing. So if you do all these things, like you get your blood work that you need to get done and you go on whichever supplements that you need to do, I am assuming that it's still not necessarily your perimenopause is just going to be a really wonderful walk down the park. I assume that you're still going to have some or not complications, but some things that you have to deal with.
Yeah, I mean, it's very individual, I would say, right? So you could also compare perimenopause to like a second puberty or a second adolescence, which no one wants to compare it to, because it's not like the first one was so much fun to go through. But in terms of like hormonal fluctuations, it's very apt to compare it to that. So if we think about it through that lens, like, you can't make puberty be easy per se, right? But what we can do is buffer it, right? We can try to minimize just how extreme some of these reactions can be, and certainly arm women with more information and tools available to them so they don't have to suffer through it, right? So, if you start experiencing hot flashes, if sleep gets incredibly challenging to achieve or maintain, which is very common to see during this time, it's not something that you just have to suck it up and get through, right? There are so many options. So whether that's supplements, whether that's HRT, which is hormone replacement therapy, like, there are just so many choices out there. And I think women deserve to be informed about it and know. So when these things do start to change, they know that there are lots of things that they can incorporate.
Yeah, I believe that. So, I mean, the first steps then really are ask your practitioner to get you some blood work and have that conversation. And I think probably be super open about what is happening to your body, because I think a lot of times we're embarrassed or we don't want to, I don't know why we don't tell them, but we don't always. So, get the blood work, get your movement in, start eating a little bit healthier, getting your protein. So you did talk about if you were overweight, say, how does that go with the protein then if somebody is listening?
Yeah, exactly. So if you don't have a lot of body fat to lose, then you can use the whole 1 gram of protein per pound of body weight. If not, then it needs to drop to about 0.8 or 0.5 grams per pound. Some people will go with what their ideal weight is and just use that. So if your ideal weight was 120 pounds, then you would go for the 120 grams of protein. That also works. It doesn't have to be, total perfection there. There are lots of really good macronutrient calculators available online that you can also use. The really good ones will take your individual numbers into consideration. So the ones that I like to use for my patients want their height, weight, and their percent body fat as well. The general ones will not request those those pieces of information. It's still better than nothing, but the really good ones take all of those things into consideration, and then it actually gives you the breakdown as to like how much protein, how much carb, how much fat should you be eating. So anyone can access those and just get a sense of where they should be starting at.
Okay, that's good. So, can you talk a little bit if somebody doesn't eat meat? Because this is such a thing, like everybody believes you have to eat meat to get the protein, which I know is not true, but can you explain that to people a little bit? So if they're, not that they are all not like, oh, I can't do this because, I don't eat meat.
Right. Yeah, and so it's a great question. So, can you get enough protein as a vegan or vegetarian? You can. I do think it is very challenging to get enough protein in and to get protein in forms that will be absorbed systemically. And that becomes more challenging the older you get because the protein requirements become that much more important. And as you get older, you decrease stomach acid production as well too, which makes assimilating protein much more challenging. So it's not that it isn't possible, but you have to be hyper vigilant about your protein intake anyways, but especially as a vegan vegetarian. So one thing that's always good to consider is the difference between protein quantity and protein density. So when I talk about increasing protein intake with my patients, everyone assumes that they have to eat like 10 steaks a day to hit these targets. And like, if you want to, great, go for it. But that is not what is required at all. So instead of thinking about it as I have to eat more of everything, which would be protein quantity, you want to look at protein density. So choosing foods that are very dense in protein per serving size, right? And this can be applicable to vegan vegetarians as well too. So, like for example, 2 tablespoons of almond butter has about 6 grams of protein in it, which is better than nothing, but it's not as high as people think it is, right? A serving size of a whey protein powder, so not even like a full measuring cup, but whatever the little scoop is in there, could be around 25 grams of protein. So which like way more dense in protein compared to like 2 tablespoons of almond butter. So even if someone just Googles like, protein dense vegan sources or, like vegetarian protein dense like sources, things like that, you'll start to see these types of things come up. So that's one thing to consider. If you are vegan vegetarian, you will need some type of protein supplement in there. There's going to have to be a protein powder in the mix, and there are lots of really good ones out there. You want to look for ones that provide a complete protein. So it's not just pea protein or just hemp, right? It's a blend of different sources of vegan protein because then it will provide all the essential amino acids as opposed to just one. That will have to be in there every single day because it's going to give you around 30 grams of protein, which will help get you over the finish line. And then considering even additional sources from supplements like creatine or free aminos, like it just becomes really challenging to get it in, but it's very, very important to get enough protein in.
Okay. Well, that's good. That's good news. And I'm not, but good news for the people that are. So,
Yeah.
so can you talk a little bit about the HRT, like the hormone replacement therapy, and is there options with that? Like, do you have to, or is there
Yeah.
options?
There's always, so from my perspective, there's always options, right? So all of us healthcare practitioners, whether it's me as a naturopathic doctor or your medical doctor or nurse practitioner or whomever, all we are just opinions at the end of the day, right? And we're just offering our perspective to you, and then it's totally up to you what you decide to do with it, right? So there are always options. Now, in terms of HRT or hormone replacement therapy, it very much depends on where you live in terms of what you can get access to. So in Alberta, where I practice as a naturopath, we don't have access to prescriptions at this point in time. So I can't prescribe in Alberta. Naturopaths can in BC, and we can in Ontario. And then there's a lot of states that we have access to prescribing rights. So it really does depend on where you live. So I can certainly talk about it. But in Alberta, you'd have to go to a medical doctor or a nurse practitioner to get access to it. So initially and even still, there's a lot of fear around HRT because of these studies that came out in the 90s that made everyone really afraid of going on hormone replacement therapy and increasing their risk of breast cancer. Right. So it was called the Women's Health Initiative, these studies that came out in the 90s. They were giving women estrogen, and they actually stopped these studies because a significant amount of the participants started developing breast cancer. And so they stopped these studies and freaked out and told everyone, you can't go on HRT because this is what's happening. Just within the last couple of years, they've gone back and reevaluated the evidence for that, and it's been really proven to be false. So what they were doing in these studies is they were using obese women who were active smokers and putting them on estrogen, and yes, they were developing cancer. That's true, but I would argue that an obese woman who's actively smoking is not representative of the entire population of females, and that category should exclude them from being on estrogen as therapy, right? So just within the past couple of years, there's been more research done showing actually, hey, this is quite safe for the vast majority of women. And it's very protective against developing things like adverse cardiovascular events. So it's really protective for women's risk of things like stroke, coronary disease, heart disease, like those types of things is what we're finding from the new research. So I think the first thing is that for women to really understand that HRT can be very safe. And the initial reports in the 90s were it was flawed research, just totally flawed.
And that is nice to know because, yeah, I think like right around the time I heard about it, I would have been probably, I don't know, in my 20s. And that was then, and everybody was like, don't do it. And you're right. Like now I hear about it and I'm like, are you sure that's a good thing? So that's nice to know that, it is safe for people to do and look into. And so if you were to do the hormone replacement therapy, what are some of the benefits to it?
It depends on what type of hormones you're doing, right? And I would say that like prescribing hormones is very much an art form. So you could go to 10 different practitioners and they might give you 10 different plans, right? So it really depends on who your practitioner is and their comfort level and experience with recommending hormones. So that's a really big one to keep in mind. But depending on whether you're looking at estrogen or progesterone, some of the benefits could be improved sleep, decreased those PMS type symptoms, improving brain fog. Certainly, it can help protect you against things like cardiovascular disease, osteoporosis, things like that. And depending on the combination, it could potentially buffer against extreme hot flashes as well too. So there's a lot of protective benefits that the combination can have. It just depends on the individual and what they're presenting with.
So what is one thing that you think that women should know about perimenopause that they don't know besides the insulin and stuff?
One thing. Oh, that's a tough one. One thing they should know. I think women really need to be reminded that, if something's wrong, it's not normal, right? We're so used to be just accepting that like, oh, my periods are really painful and they suck, and that's just like the way it's gonna be. Or like, oh, I know I'm gonna have terrible hot flashes because my mother did, and I just have to suffer through it. Like this is just what our lot in life as women, right? And it's just not true. Like it's just categorically not true. There is no need to suffer. There's no benefit to that whatsoever. And if you have a healthcare practitioner that's being dismissive of whatever your experience is, then you need to find someone else who's not, right? We're not going to cure perimenopause, quote unquote, but there is no reason that you should be suffering from symptoms, right? There's so much that can be done to game it and to improve these things. And I just wish women would know that more. They just get dismissed a lot of the times, or they get put down a different diagnostic pathway, like, oh, maybe you have depression or there's something else going on. And it's like, well, then maybe she just needs some hormone replacement, and that's a better option for her too, right? Like that. I just wish that was better understood. That there's no reason to suffer. There's just none.
Yeah, I think we need a lot more advocacy with our own bodies and our own.
Yeah.
And it's nice to know that, right? Like, because I don't even think that we know that we can go to, when we find these things out, go to our practitioner and be like, hey, I want these tests. Like, I want you to check my thyroid and I want you to check my, you know, different things that you're talking about because it's only going to help us get healthier. So I think that's
Yeah.
a really good thing to know that we actually have that power to do those things.
You definitely have the power to request them. Whether or not you get them is a difference, right? So in Alberta, I can write a lab requisition. It goes to the same lab as physicians do. So I order a lot of blood work for my patients. You have to pay out of pocket through me, but it's charged on a per test basis. So it just depends on what these tests cost. And it could be $10 or $50 per test. It just depends. But it really depends on your primary care provider in terms of what they will be willing to write for you, right? So I've seen some docs cover the vast majority of what the patient would like to see, and others will not cover it, right? So you can go in there and negotiate and then see what you get. And then there might be additional things that need to be looked into, but it really depends. And another thing to keep in mind with blood work is the reference ranges that are being used, right? So a healthy reference range has little to do with what the evidence says and a lot to do with where you live, right? So even the reference ranges that we use in Alberta can be different than what they use in BC, which is kind of crazy if you think about it, right? And so what conventional medicine does with reference ranges is they look at it from an all or nothing perspective. You're either sick or you're healthy. Whereas I tend to use more functional or optimal ranges. So it's a more narrow range. So we look at it, are you working as well as you could? Now, these are still all evidence-based numbers, but it's just not a public health approach to it. So oftentimes you could get all the blood work that you want from your care provider, and they'll say, oh yeah, you're totally fine. This looks great. But then someone like me could look at it and be like, well, actually, there's some issues here that we want to intervene early on before they become an overt problem as well. So that's something to really remember. I have patients come in all the time and say, oh yeah, I did my blood work and they said everything was fine. I'd be like, yeah, I'll believe that when I actually see the labs. It's almost never true. So, yeah.
So getting into a practitioner or someone earlier is better than waiting
Oh,
longer to your perimenopause.
as with anything, right? Like it's much easier to adjust when things are in the early stages, as opposed to when you've been dealing with a problem for 20 years, right? So if we can intervene early, that's much easier to deal with, right? So the prevention is really key.
Yes, yeah. That that makes sense to me.
Yeah.
So using estrogen that also help to prevent bad dryness and that kind of thing as you come towards the end of your
Yeah.
menopause sort of thing.
Absolutely. So it would be up to the prescribing professional to determine if, like oral estrogen or systemic estrogen, usually in a patch, makes a lot of sense, or a topical, like vaginal, like estrogen makes more sense. But I would say that's one of the most direct things that can be used. And women can really suffer with vaginal dryness. Like it can be debilitating. It's not just like a minor discomfort, it can be a significant problem in their lives. And so that should be first line treatment, frankly, for a lot of women out there. And in like topical, like vaginal estrogen is so safe, right? There's even been studies that have come out that look at it for women with a history of breast cancer, and it's deemed to be safe in that population as well too. And like that's the evidence. It's what it actually shows in the research. So it's just not absorbed systemically to any great concern. So it can be very much a lifesaver for some women.
That's very cool.
Yeah.
It really is. I asked about that because I did use an estrogen when I was 52 for that, and it really worked.
Yeah.
So yeah.
Yeah, it can even be helpful for some women experiencing incontinence, right? So some like bladder leakage or urine leakage as they get older. So everyone should get checked out by like a pelvic floor physio, right? Like that's really important as well. But because the tissue shrinks, we tend to think of it only for the vagina, but it can shrink around the urethra as well too, right? Like where the urine comes out. And sometimes, even just using topical estrogen there plumps up the tissue again and can have a positive impact on urinary leakage. So, it's good to think about it holistically as well. Like, what are all of the surrounding impacts of it?
Mm-hmm. Yeah,
that's good.
That is good to know because you hear so many things, and of course, because social media is out there, there's just everybody knows everything, right? I often joke with my granddaughter, of course that's true, because you heard it on TikTok. But
Yeah.
so that's great that there's people like you that can answer these questions and kind of guide us along the way with it, because I think that's so important. Because one thing that I heard is that during perimenopause, your cholesterol can go up. That can be
Mhm.
affected by it. Is
Right.
that
And so why does the cholesterol go up?
yes?
That's the question that should be asked, right? So cholesterol, like if you get your blood work done and your cholesterol is high, your cholesterol panel is not an indication of the cholesterol content of your diet, right? That is not what the cholesterol panel is showing you. A cholesterol panel is way more indicative of what your liver is doing and what your blood sugar and insulin levels are. That's what has the big impact on cholesterol, right? So it's not a matter of cutting out high cholesterol foods. That is another leftover remnant from the 90s and is unbelievably false, right? So if your cholesterol is high, most likely it's because you have insulin resistance and potentially a degree of fatty liver as well. And the two tend to go together, right? And so that is going to be all wrapped up in one. So anything that's going to improve blood sugar and insulin balance, you will see an improvement with cholesterol as well.
Okay, that's good to know. Yeah,
Yep.
because I had heard that. So again, I guess it all comes really back down to taking care of ourselves, moving more, drinking more water, um, eating healthier, or within reason. I mean,
Yeah. Yeah, there's a life and lifestyle, of course, right?
yeah.
Like that's fine. We need to enjoy things as well too. Um, but but it's there's just so much that can be done. And a lot of people, like by the time they're coming in presenting with insulin resistance or maybe high cholesterol, diet and lifestyle will take you to a certain extent, but it may not take you all the way. Right. And so it's important to know what else can be incorporated to help support you through that process, right? Especially if the liver is engaged. Like if there's a degree of fatty liver, it can be very difficult to lose weight and see changes without additional support, right? The fatty liver is not normal and that needs to be addressed. And there is a lot of fatty liver out there these days too. It's very common to see it, but it's not normal. It's common, but not normal.
Okay. So then when you're getting these blood tests and you're going to your practitioner, like should we be asking the questions? Like if you let's just for say you go to the doctor and they say, your thyroid's out of whack or your cholesterol's high or what have you, should we be then following up and sort of asking those questions like why is it that? You know, because I find that a lot of times, especially, I mean, medical doctors have their place for sure, but I find a lot of times that they just want to give us a prescription for something and there's no real discussion about why we are taking this medication.
Yeah, I mean that's true. I mean, I feel very badly for doctors in terms of the constraints they have on their ability to practice, right? Like a lot of them can only do, like a 10-minute appointment. And I can't imagine functioning in a 10-minute appointment. Like it's just not possible to get enough information or to have a conversation with the patient, right? So it's just an incredibly difficult way of practicing. So I would always encourage people to ask questions as to why is this happening and what's going on there. It'll just depend on the practitioner whether or not they know. For one thing, right? They may not actually understand the processes that they're talking about, and then what their practice style is like. Like most of them are trained to give a prescription to fix quote unquote the symptom, and there is a time and place for prescriptions, right? Like if I had prescription rights in Alberta, I would prescribe things like Synthroid and antibiotics and even a hormonal birth control at times too. Like there's a time and place for all of these things. but that's their approach. Their approach is not typically to go into like a functional medicine lifestyle in depth view of it. It's just a different way of looking at the problem.
Yeah.
Mhm.
Yeah. And that is so true. But I just I just think again, I think it comes back to being an advocate for ourselves and asking
Yeah.
these questions. And, if you're not happy with your doctor, they're not giving you, definitely go somewhere else to get that information or
Yeah, and I think like especially as Canadians, people feel like they don't have the ability to choose their healthcare provider because it's not like we have an overabundance of docs, and if you get one, you should just be grateful for who you get. That's kind of our scarcity mentality when it comes to healthcare here, and so that can be very limiting depending on availability. But I think it's also really important to find someone that you trust and works well with you. And a great untapped resource are nurse practitioners, right? So nurse practitioners are becoming way more common in this
Mhm.
country, and certainly in Alberta. They have prescribing rights. They can write lab requisitions and imaging, like ultrasounds, and they are becoming more of a frontline primary care provider as well. So I would always encourage people to look at any available nurse practitioners opening up practices because they are typically wonderful to work with and are very open-minded when it comes to treatment options.
Yeah, we actually
Yeah,
have
they
one
are.
here in Camrose that opened up, and
Mm-hmm.
yeah, I haven't been myself, but my granddaughter was there, and yeah, I've heard other people, they're just amazing. So
Yeah,
yeah, I
exactly.
highly recommend them too.
Yeah,
So
they're wonderful.
yes. So can you tell everybody where they can find you?
Yeah, so right now I practice in Calgary at Vive Health, which is in the northwest of Calgary. And so they can come see me there. We also provide virtual appointments too. So as long as you are in Alberta, I can see you anywhere in the province. We can, we don't actually have to meet in person, but we can do virtual consults, which is really a great option these days too. They can find me on Instagram. My handle is at your pelvic ND. And my website's on there. It's just yourpelvicnd.com. And if you go to my site or on Instagram, you can also sign up to get my newsletter. And I have like a freebie kind of hormone handout that you get when you sign up for that too. So Instagram is kind of the best place to find me though on social media. I tend to be there the most frequently.
Nice. Perfect.
Boy, you're a busy girl. You are a busy girl.
Very busy. It's a good thing. Better than the alternative.
That's true.
Absolutely. So if you had a final thought to leave with everybody, what would it be?
Oh goodness. Um, I would just encourage women to not settle for what they're being told, right? So if someone's telling you that this is just the way it is and you have to deal with it and just suck it up, like just question that, like is that true? Does that make sense? Like, and really try to be as much of an advocate for yourself as possible. So if you don't like the perspective someone is giving you, then go talk to someone else, right? There are lots of different options out there and there are almost always alternatives to things. So find what works with you and trust yourself. If you know something is off, and something is off, and find someone who will work with you on that.
Perfect.
Yes, that is wonderful. So we
Mm-hmm.
really appreciate you coming back on with us, and it's been such a pleasure. You've got so much information, and I think this is,
And
we
then,
both think this is really going to help everybody because it does seem like such a thing. Like I'm seeing it all over social media, and I've had that conversation with some coworkers and things like that. Like, oh, like this is how I'm feeling, and you know, we never used to discuss that before, so it's nice that we've come to that age, but it's so
it
wonderful
is.
to share that knowledge with
Yeah,
us.
yeah,
Well,
very
I
good.
could talk about it all day. That's pretty easy.
Well, we will definitely, so everybody kind of has a tidbit. We are going to try to get Dr. Kate on to do a live with us, so you'll be able to message in and ask some questions. So we'll set that up sometime this year. So thank you for doing that because that's amazing.
That was
Because
Yeah,
fun.
I think,
yeah, that's fine.
people have questions that we don't have depending on where you are in life, right? So
Yeah, totally.
wonderful. Well, thank you again, and hope you'll come back again, besides the live, because you always got good information.
Well, thanks so much for having me. It's always a good time.
Yes.
Okay.
And everybody else, we will see you the next time.
You bet.